Welcome you all to the Zoho Creator's Learning Table series for the month of February. So, before we get started with the session, let me quickly give you an introduction onto the Learning Table series. So, this is for people who are new to the series. So, Learning Table series is a month-on-month session where we take a particular industry and we try to build Zoho Creator upon that particular industry that we have taken up. And for the month of February, we have chosen the healthcare industry. So the Learning Table series is a monthly session which will be held on first Thursday of every month. So getting started with the session, we'll talk about the healthcare industry in this particular session. So in the healthcare industry, we have identified the inpatient management and we have tried to automate few of the process and the major process that are involved in the inpatient management and how we can build an application through it. Right. So before we get started, let me introduce myself. I'm Pungoday from the Zoho Creator training team and I'll be taking you throughout this 1-hour webinar. So before we get started with the session, we have few of the housekeeping rules. All the attendees will be on mute throughout the session. If you have any questions in between the session, you can post them in the question tab. And a recording of the session will be sent to all the registrants. And please to participate in the polls and surveys that we might have at the end of the session as well. Now, let's take a look at the agenda for the 1-hour webinar. So we'll start with an introduction onto the creator and then we'll enter into the industry that we have taken and we'll talk about the inpatient management. And within the inpatient management, the different automations that we have created for an application. So we'll look into the application process flow. Later on, we'll cover the different features that we have incorporated in the application. And further, we will enter into the live demonstration of the application. And further, we'll talk about the extended use cases. So apart from just the application that we showcase during the session, what other use cases that we can involve in this particular inpatient management or in a healthcare setting. And at the end of the session, we will give you a summary of what we saw in this particular 1-hour webinar. Now, before we enter into the session, let me close my camera. Let's get started with the introduction to the session here. I'll just quickly give you an overview about what is Zoho Creator. So this is for people who are new to the session and new to Creator as well. So this is Creator is not only an custom application development platform, but it is also an platform which is a combination of an application development, business intelligence, and you'll be able to get the analysis of your data and perform integrations with other different solutions as well. And everything combined in one platform. So this would help you to streamline the business process and increase the productivity in enhanced manner. So onto the right side, you can see we have an image representing the Zoho Creator and how it can be fit into other different industries. So whenever we try to build a solution in Creator, you will be able to find that it can be categorized under something called as an application category. So first, let me discuss about what are these categories. So the first category is the internal tool. So let's say I'm trying to build an application for an internal purpose for a task manager or a project management application, which would be majorly used within a team or within an organization. So then these applications would be categorized under the internal tool. And next, we have the second category, which is the portal-based application. Here, when you are trying to build an application for an external user, unlike the internal tool, if you are trying to manage a vendor or trying to manage a supplier or even you're trying to interact with a customer, then it can be categorized under the portal base if you are interacting your application with an external stakeholders. And then we have the third category, which is the core system. So if I take an industry and I'm trying to automate many different processes of the industry within a single application, then those applications can be categorized under the core system. At last, we have something called as the extended Zoho or third-party application. If I'm trying to integrate my creator account with other third-party services in order to push and pull data, then those applications can be categorized under the extended Zoho or third-party application. So as I said before, every application we build on Creator can be categorized under these mentioned categories. And also it can be a combination of the multiple categories that I've mentioned over here. So whenever you try to build an application, it can be followed through a process which is called the application development lifecycle management. So let me tell you what this is about. So when you are developing an application, the application lifecycle management can be followed in the steps that are mentioned here. The first step would be analyzing the requirement. So what is the purpose of building this application? Who are going to be the stakeholders of this application? Has to be analyzed before you start building an application. So once you have gathered the required information, once the analysis is completed, you will move on to the next step, which is going to be structuring the application. So what are the modules needed to build the forms? What are the other reports that you need to add here? So that how you are going to bring in the flow inside your application, that needs to be analyzed here. So once the structuring is completed, you will have to move on to the next part, which would be developing your application. So once the development is completed, once you have created all the reports, all the modules that you want inside your application, you will move on to the next part, which is the deployment of your application. So you will test the application, you will deploy the application, and then we can manage the application. So how the stakeholders are being given with the permissions, and the different roles and permissions that needs to be added here. So that would be managed under the manage part of your application. So this is all about the application category and how you can develop an application in Creator. So now let's talk about the industry that we have taken up for the session, which is the healthcare industry. So when you talk about an healthcare industry, it is a vital sector focused on preventing, diagnosing, and treating and managing the illness and the health condition of patients. And now adding technology to the current healthcare system, and it has brought in a next step into the healthcare system itself, wherein how the delivery how the healthcare delivery is being provided, and making it more efficient and accessible and personalized to individual healthcare professional and the patients who are coming in. And talking about the health electronically stored information, so in the aspect of sharing the information to the patients, or reducing the errors that might occur while having these information stored, and improving the coordination across the healthcare providers, right? So now what we have done is that we have taken the uh, inpatient management as a core, and we have tried to capture the major processes, right? So now before we enter into the session, we also have previous sessions held on the healthcare system, wherein in the year 2023 we had the application built as in the hospital outpatient management, which was as an extended Zoho application. So where the doctor's information, doctor schedules, and how the new patient has been registered, and other booking related information for the patient, and how the information of the patient is being stored. So we have connected with multiple other Zoho products here. So if you are interested in this specific process, and if you wish to take a look at the session, you can scan this particular QR and register to the course that is available. So I'm keeping this open, or you can also use the link that my co-trainer will be sharing you in the chat section. Now, in the year 2024, we had another set of application created for the healthcare system that was based on the hospital management, wherein the application was created as a core system here. The outpatient management, inpatient management, inventory management, and even the staff management were monitored and managed under the specific application, where the automation was throughout these four major processes, right? So if you are interested in understanding Creator as a core system, you can scan this QR and register for the session. My co-trainer will also be sharing you the course link for the same, and I'm keeping this open for another second so you can scan this and access the course as well. So now getting started with the session for today, we will talk about the inpatient management. So what and all process that we have automated, what are the major processes that is in the inpatient management. So we'll talk about the patient admission, how we can automate that, and the treatment coordination between the multiple healthcare professionals, and how we can manage the facilities that are available in the hospital, and the vitals monitoring. So what is the current condition of the patient, and the medication management. So what is the medicine provided to the patient and what needs to be followed up, and the other billing related information and the insurance information can be captured and processed over here. And also the post care planning of the same is also monitored here, how you are following up with the patient as well, right? Now, talking about the application process flow. So, based on the major process, we have created an application process flow, how we have built the application. Starting with the first part, the application category. So, under which category we can bring this application into. So, it is a combination of internal tool and an extended Zoho application. So all the major stakeholders in the inpatient management would be the nurse and the admin and the pharmacy people, lab people. So it will be majorly based on the internal users who are using the application. Talking about this application as an extended Zoho application, because we have integrated with other Zoho applications to cater few of the automations here. So let's enter into the different stakeholders who are part of it. First, we'll have the admin, who is part of the internal process where he handles all the patient admission. He discharges and he takes care of the record related information of the patient. And then we have the nurse station, where the coordination of the care plan and the schedule for the treatment and the monitoring of the patient will be happening there. And then we have the pharmacy, where the pharmacy would receive requests from the nurse station, and then they will share the medication. They will deliver the medication to the nurse station, and then they will manage the overall inventory related to the medicines that are available in the healthcare setting. And at last, we have the lab. So here the diagnostic testing will happen, and then the results will be provided for the patient, and based on the results the further treatments will be altered accordingly. So this would be the different stakeholders and the activities that they perform, and this is what we have tried to automate in the particular application that we'll be looking in the upcoming demonstration. So first, let's talk about the activities performed by the admin, starting with the admission related works. So he will register the patient information and he will perform the admission process, and he will also allocate the available rooms and put the appointment for the particular patient and manages the discharge billings along with that. And next, he will manage the medical staff. So the number of departments that are available, active departments, inactive department, number of doctors that are available, and the number of appointments that has been fixed will be monitored by the admin, and the information related to the staffs and their shift will also be monitored and handled by the admin. And the next set of action is that he will take care of the rooms that are available in the hospital, like the number of rooms, number of beds that are available, and how it can be allocated to people who are coming in for the admission process. And next, we have another set of stakeholders, which is the nurse station, where they take care of all the patient related activities. Starting with the admission process, they will intake the patient and they will collect the history related to the patient, any medical condition, and what type of treatment are they coming in for, and the type of surgical procedure or the treatment that they have to uh, take care of. And then the monitoring of the patient will also be capturing under this particular admission process. And then the medication. So if they are coming in for any surgical procedure or if it is related to any treatment, the medicine has to be given to the patient on a scheduled manner. So that will be taken care by the nurse station. And the pharmacy request. So from the nurse station, the pharmacy people will be receiving the request, and once the pharmacy people receives the request, they will deliver the medications to the nurse station, and then the nurse station will be able to provide the medicines to the patient. And next we will have the appointment information. So during their admission in the healthcare sector, healthcare hospital or any other setting, they will have to book appointments for the scanning or for the doctor as well. So for example, if a patient is coming in and they have a surgery schedule, so in the meantime, during their admission, they will have to go for the appointments of multiple testing and scanning, and they'll have to have a follow-up with the doctors. So that would be arranged by the nurse station. And then if they're going for any lab testing, the reports would be collected by the nurse station. And at last they will have to take care of the discharge billing as well. So when once they receive the pharmacy related information, the billings and the medicine, once it is delivered, they will have it mapped under the patient name. Similar to the surgery, once the surgery is completed for the patient, they will have it mapped under the patient name and all the appointment related information as well. So the overall appointment, admission and the medication details will be captured and monitored and managed by the nurse station. And another set of activities are they will also be able to view multiple records and other information related to the patient and the healthcare setting. So this is a simple dashboard that we have built in the application where they can view all the patients that are coming in and the current patient, the available beds, and few of the modules that they can access related to the hospital. And now you can see this is a dashboard that I mentioned. We have used the ZML and the HTML snippet to build this one, and we have used few more components to enhance the UI capability in Creator, right? So what the nurse station will do is that once they receive this particular access to this module, they will be able to view the report related to the particular patient. So they can access the report information wherein the patient's basic information like the name and the blood type and other health related information and admission related information will be added over here. And whenever the nurse station adds any new appointment, adds any medication, that would also be visible over here. So here as well we have used a HTML snippet to bring in this type of visualization. And next set of activity that the nurse station can do is that they can get to view the discharge summary. So once they have completed the overall treatment process and they discharge the patient, they can always view the discharge summary of the patient, and if they wish to take a printout of it and share it with the patient, that is also possible, right? The next set of activity, which is the lab related activity, wherein the nurse station would raise some request an appointment for the scanning or any other testing, right? So in that particular appointment booking, we will have to track the number of appointments coming in. Do we have a slot available or not? So for this, what we have done is that, as I previously mentioned, we are connecting with a Zoho application here. So we have connected it with the Zoho bookings, wherein whenever the nurse station raises an appointment for a scan or any testing, it will be stored in the Zoho booking and where it can be monitored and managed. So once the booking of an appointment is done, the patient will be taken by the nurse station. They intake the patient and they will collect the particular requirement, if it is a blood sample or if they're going for an MRI or any other scanning. Once they perform the particular requirement, they will send the results. So the lab people will send the results or the reports to the nurse station and they can share it with the patient. So once the lab reports are available, they will have to bill the information. So they will have to bill it under the naming for the patient. So the bills that has been received for the scan and any other appointment will be billed under the patient here. And the next activity is the pharmacy related actions. So where when the nurse station requests for the pharmacy personnel will check with their inventory, and based on their availability, they will deliver the medicine to the nurse station back. And once the nurse station receives the medication, they will give it to the patient based on the scheduled time, right? And once they receive the particular delivery medications, they will have the medication details added to the billings as well, right? So this is all about the application flow, so how we are connecting with other um, modules and how we are interacting with multiple internal stakeholders, and at last how the discharge process will happen. So now let's take a quick look at the different features that we have used in this application. So starting with the integration flow. So previously I mentioned that we will be using the Zoho bookings to perform the integration task to manage and monitor all the bookings related activity, right? And then we have the users. Since we have majority of the users are the internal stakeholders like the nurse, the admin and the pharmacy personnel, we will be adding the internal users into the application as an app user. So we'll be talking about that. And then the snippets. So in the presentation, I showcased you a few of the dashboards, right? So we have created multiple dashboards using the ZML and the HTML snippet to bring in the to enhance the UI of the Zoho Creator. And last, we have Canvas Builder to view to have a customized detailed view of a report as well, right? So now let's enter into the live demonstration without any further delay. Right. So this is the application that we have developed for the inpatient management. So where we have the nurse station, this is the first module that you can see. This is a dashboard where the nurses can view all the inpatient details, the admission count and the pending discharges and any transfers. And also the current patient list is also viewed here, wherein the details of the patient like the name, ward details, doctor information, appointment, if they wish to book an appointment from here, that is also possible, and the overall report information. And beneath that we have something called as the bed availability. So the nurse station can also view the number of bed that is available, the number of rooms that are available for the patient to come in. And on the right you can see we have used a HTML snippet over here to capture the quick links that are available. So if the nurse or any healthcare professional would like to create a new admission, add a patient record or manage the bed or even view the discharge summary, that can be accessed from these quick links as well, right? And then we have the admin module, wherein the admin will be able to view the number of patients, doctors available, staffs available, and even the wards that are available in this particular dashboard. So this is the ZML panel that we have here, and beneath that we have an HTML snippet which would redirect the admin to access these different modules. Rather than scrolling into the modules that we have created, using these quick links they'll be able to access the modules that we have created. And next we have the departments, the different departments that are in the particular healthcare setting. And then we have the ward rooms. So the individual room basis and the bed basis availability can be viewed here, where you can see the available facilities, room capacity and the room numbers and the room status, if it is available or occupied. So that information will be visible here. And then we have the doctors information. So the number of doctors who are here in the particular hospital setting. And then we have the staff related information and the patient related information who have been admitted into the healthcare setting. And then the admission details. So here's where the overall admission related to the patient will be visible. So the medications provided, the treatment plan and the surgery plan and even the discharge related information will be available over here. And then we have the pharmacy, which consists of all the inventory related to the pharmacy details. And then we have the pharmacy request. So this is the request that would be raised by the nurse station to the pharmacy to procure the medications that has to be assigned to the patient. And we also have the pharmacy bill. Once the payment is done, this will be created for the patient under their admission ID. And the appointments that is being booked by the nurse station for individual inpatient is available here, and other references like the bed numbers, the patient medications that is being provided, and the patient bill are under here your references, right? So now, as I mentioned, we have built this application based on an internal application, right? So what we have done is that we have added the user as in based on their permission. Like we have the receptionist, we have the nurse station, and the pharmacy. So what we'll be doing is that we'll be moving across the application with these three different permission set, and I'll show you how the application will be visualized by the three different stakeholders inside the healthcare setting. So let's first start with the receptionist, the admin. So what I've done is that I've already provided the access to one of the demo user, and now we'll take a look at how it will be visible, right? So this is the account for which I've given the permission, and let's take a look at the admission application of the admin, right? So this would be the interface for the admin. He will be able to access the admin dashboard where the total admission and total patient and all the other details that I mentioned in the panel will be available. And then we have the quick links. So if the admin would like to add a patient, he can just click onto this quick link and he'll be redirected to the specific module. And then we have the department. So in a hospital you'll have multiple department, right? So we might have few of the available departments. Some of the department might be inactive because of the unavailability of a doctor, right? So that would be managed under this particular section by the admin. So let's say we'll add a new department for the hospital setting. Let's say a general surgery department, where the general surgery will be specialized in focusing on any abdominal or any other ailment. So let's see, surgery or surgical specialty focus on So this is a simple description I'm giving. So based on the department name, we can give the right description as well. So we can map this department status to be active. And then once this is done, the new department will be added into your hospital setting. And once the admin has completed this, he will have it added as active department, right? And next, the admin will be able to manage the ward rooms. So the number of rooms and number of beds that are available here. So let's try to add one of a room here. So let's say double room, general, and then we will give the room type. So it is a semi-private. So since we have created as double room, we'll keep it as semi-private, and number of rooms that will be available here, we'll have it one room, and the capacity of the room will be 2, and the bed numbers. So these are the existing bed numbers, but I can give my own bed number here. So for specific to this room, we can create a bed number, which will be 201. And let's say the bed is available, and another bed, we can say it as 202, and done. And what are the facilities that would be available? So you can see we have currently listed TV, AC, oxygen cylinder, and Wi-Fi. So let's say this particular room will have TV and AC. And the room status. So is it occupied by all the beds are occupied, or it is currently under maintenance, or it is available? So we'll map it as under maintenance and let's submit it. So you can see it will be mapped as under maintenance, and it will not be visible when someone is trying to when the admin is trying to book this particular room for a particular patient. So let's for now map it as available. So upon the room status, we'll have it added to the patient whenever they're trying to come in for the admission process. And then we have the doctor information. So where the new doctors or any new hiring is done for the doctor, that would be added here. So let's try to add a doctor here. And now let's give a email address and the address for the doctor. Phone number and the department of the doctor can be added here. Let's see, and then the qualification and the years of experience of this doctor. See 7, and then the consultation fee, and is the doctor available. So this is the information that you're collecting from the doctor, right? So what we have done here is that we have connected the creator application with Zoho bookings here as well, because whenever the doctor information is added, we want the staff information to be stored in Zoho bookings. So whenever an appointment is being done from the nurse side, we want the details to be mapped to the doctor as well. So what we have done is that we have integrated this specific module with Zoho bookings, right? So let me submit this, and upon submission, the email invite will be sent to this particular user. So let's see, let me just refresh this. So the user will receive the invitation link for the Zoho bookings. So upon confirmation of the account, the staff will be added into the bookings. So let me show you the Zoho bookings here. So this is my Zoho bookings account, and we have the staff information. Let me refresh it. Yeah, so now we can see we have the recent entry, Niti H. Yeah, so the invitation is still in pending. So once the doctor accepts the invitation, the staff will be added into the Zoho bookings, and whenever a booking is done for this particular staff, it will be mapped under the calendar forum, right? So now moving ahead with the next module, we have staff related information. So if the admin would like to add a new stuff, so let's say we have a new nurse coming in, so we'll have to capture the information. So let's see, Tia, and email address, and let me add the address, phone number, and the date of birth, gender, and the role that they are currently at in the hospital. So it can be a nurse, admin, or a technician. So currently we are listing only 3. So based on the role that is available in your healthcare setting, you can add that as well. So let me add a nurse and the shift timing. So let's say night shift and the department that they'll be working in. So we'll put them in the emergency ward, and the status of the staff. So are they full time or a part time or a contract employee? So we'll mention it as a part-time employee and submit. So the details will be available here, right? So this is how we can the admin will be able to add new staffs. And then here comes the part where the patient intake will happen, where the information of the patient will be captured. So the admin will collect the basic information from the patient. And the date of birth will be captured, and the age, and gender, contact information, and the email address, and the address of the patient, and the emergency contact has to be captured here. And the relationship, the contact, and then the medical information of the patient will be captured here, like the blood type and the height, the weight of the patient, blood pressure, if they have any allergies, that can be notified. So if they don't have any allergies, we can just give it as not applicable. So this would be helpful if they have any allergies related to any food items or any medications that has been given to them, right? So what would be the medical condition? So let's say a simple skin allergy and any family history related to any medical condition, so that can be captured. So if they do not have any medical condition, we can give it as NA. And next, here comes the part if they have any insurance. So if they have an insurance, we can capture the insurance provider information and the policy number and the coverage amount. So once they submit it, the patient information will be captured, and then here comes the part where the admin will admit the patient, wherein the admission related information like the health information will be captured. So we will mention it as planned admission type, and we have the admission date. We can mention the time as well, and then the patient information. So while we were creating the patient ID would be allocated to them. So wherein our patient Mythili will have the patient ID as 14, and then the insurance coverage. So since we already gave the details related to the insurance in the previous module where the admin captured that information, it is automatically populated here. And the admission reason, so let's say skin allergy, and the medical assignment, which department. So let's say dermatology, we will have the doctor who is available, right? So we can give any type of departments, and the doctors who were allocated to that specific department will be available here, right? So let's map the doctor with one of the ID, and then the surgery requirement. So if they have any surgery requirement, we'll have to choose that surgery is required here, and we'll have to fix the date for the surgery as well. And then the procedure, like we can mention just the procedure that they are trying to perform, and then the room allocation. So here comes the part where the admin will take care of the room allocation for the inpatient. So we have created multiple rooms over here, right? So let's say we created the recent double room, and then the bedrooms, the bed numbers are available here. So wherein we can choose among the bed numbers, and it will be assigned to that particular patient. And then the status and notes related to the patient. So currently the patient is getting admitted. So if you wish to add any reference, that can be added here during the patient admission. So if they have any allergies, this particular note or reference will be used across, or if they are being transferred, that can be used as well, right? And then once the admin submits this information, the patient information will be added successfully. So this would be the detailed view of the particular patient, wherein we have used the canvas builder to create this particular view, wherein we have the admission details, patient details, and we have added few of the custom action buttons in this view, and we have added multiple tabs within it, wherein if the nurse station has raised any medication, that will be visualized here, and the surgery, if we have any we have planned any, that will be visualized here, and the medical history, insurance details, and the doctor assigned, and even the allocated rooms. And then the pharmacy related information will be visualized here, right? So now once the admin has completed the first set of activity, so he will be able to view all the patient related information, right? So next part, the nurse has to provide the further treatment related progress, right? So in that part, we'll change the user permission. We'll change the internal user permission to the nurse station. So let me take you to the part on how it can be viewed by the internal stakeholder as a nurse or any other healthcare professional. So as soon as we enter into the nurse station permission set, we have the dashboard being taken to us, where we have the total number of patient, admission details. So we had a recent admission today, and the pending discharges, and the number of transfers. And previously, while I was demonstrating you, we had the details of the current patient, wherein the nurse station can book the appointment from here, or even get the overall report of the patient from here as well. And the quick links to redirect themselves into multiple modules that are available. And this is pretty much about that. Now what we'll do, we'll enter into the other module where we have all the ward related information. So here you can see, once the admin has added the information for the particular inpatient as room number 201, it is saying that it is occupied. So based on the patient who has been admission, the room bed numbers and the room will be showing as occupied and available. Right? And next we have the doctor related information, the patient related information, and here comes the part, the admission details. So this is where the nurse or the healthcare professional will have details related to on what needs to be done further ahead. So first, once the nurse receives the patient, collects the information, they will start the patient with the medication. So initially they will provide the medication, or the doctors will prescribe the medication here. So by clicking onto this button, so once they enter into the detailed view, they will be able to access this custom action, click onto the button, and they will be able to add the patient medication here. So let's see, antibiotic syrup, let's give the dosage and the frequency daily, and from morning, and in the night we want it to be given to the particular user, the patient, and the count time, one time per meal, and then the count per day we'll have two times that is being given to the particular patient, and from the date of admission, and we want it to be done till 10th of February before the surgery date, and who with by whom it has been prescribed, that information, and notes if they have any. I'll mention check for any allergy, right? And then we'll add another medication here, which would be multivitamin tablets, let's say 50-gram dosage daily basis, and the frequency morning, afternoon, and night, right? So that would be one count per time, and then the count per day would be 3, and the start date would be 6, and we can end it till the surgery date, and this would be prescribed by another doctor. So that is not much required. So once the medication details been added, it will be mapped under the patient here. So under the custom action buttons, we have the medication details, right? So as you can see, we have the medications which was prescribed by the doctor is available here. Now what will happen is the nurse station will request for the medication that needs to be given to the patient. So what they'll do, they'll click onto this button, and a pharmacy request will be raised. So they'll choose the medication ID, and here you can see we have the medication ID being populated, and the antibiotic syrup and the multivitamin tablet is added here, and the status, it is not yet provided to the patient yet, but you can see the quantity is being different here. Why? Because based on the count and based on the number of times the patient has to take the medication, we have written an automation to provide the quantity automatically, right? And the billing status is yet to be paid. And once we choose the sum requested by, so let's choose one of the healthcare professional, and once it has been added, the pharmacy request would be raised separately. So you can see this is the medication, and we have raised the pharmacy request as well. So current status is pending. Why? Because the pharmacy personnel will have to deliver this particular medication to the patient, right? So now what we'll do, we'll have to enter into the next set of permission where the pharmacy personnel can access the module. So let me enter into the pharmacy. Right, let me refresh the page. Now you can see how the application will be visualized by the pharmacy personnel if we are providing the pharmacy permission set. So they will be able to view all the medicine related information and the stock and the manufacturers and the expiry date as well. And under the pharmacy request, they will be able to view that we have a pending delivery status, wherein this was the recent patient that was added by us and the request was done by Tia, one of the nurse or the healthcare professional. And now what the pharmacy personnel will do, they will check for the inventory if they have the medication. So they'll check the medication details. Yeah. So if they have the information, they will deliver it to the particular nurse station. And once they have delivered it, they will have this particular information added to the billing of the patient. So here we have the quantity which was previously automated, and here as well you have the unit price of the medication. So what we have done, we have fetched the medication information from the inventory and we have populated the unit price and we have calculated the total cost as well. And now once the pharmacy personnel submits this particular bill, it will be created, a bill will be created, and now we can add the bill to the patient under his name. So once this is completed, the pharmacy information will be added to the patient. So now we can see that the patient has been added to the medication that was given to the patient is being added here. If they wish to take a print out of it, we'll be able to give the printed value, where we have the admission details, the medication details, and the total pricing as well. So now once the pharmacy has completed their work, the nurse will receive the medication and they'll start giving the medicine to the patient. So now let me change the permission set to the nurse station. So now let's access the application on how the nurse will be able to view the app further and how they can take care of the patient from here. So we have the information in all patient admission. So under the pharmacy request, we have the status change to delivered. And then under the pharmacy billing, so the overall billing is being added. Now what will happen? The payment status is yet to be done. So what we can do, once the patient makes the payment for the billing, the pharmacy billing, we can map it as bill paid. So this would be the way on how we can update the status. And even I can write a payment workflow over here if it is required, right? So now once the billing is being added here, this would be reflected in the overall report of the patient. So this is related to the medication and the billing details. Now if they wish to have a lab testing or a scan done in between the admission, so what they'll have to do is that the nurse will raise an appointment for the scan or a doctor booking. So once they click on to the scan appointment, they can easily raise an appointment for the scanning. So let's say scan, and then the room information, admission ID is being automatically populated, and the date of appointment. So when do they want the appointment? So let's say on the date of their surgery, and we would like to have it at 4 p.m. and the type of scan. So let's say an ultrasound would be helpful, or even a CT or any other scan that they want to, right? So additional note for the appointment, we can mention that they have skin allergy and the appointment is being scheduled, and the cost of the appointment, let's say 2000, and the bill status is yet to be paid, right? And here is a lab report. So once the scanning is done, the lab technician will have it updated in this particular module. So let's submit this, and the request is being raised for the lab technician. So now as you can see, this would be available. So now what we have done is that once they submit this particular scan, the booking will be automatically populated. This will be created in the Zoho booking. So during the presentation, I mentioned that we have integrated the creator with the Zoho bookings. Now let me take you to my Zoho bookings here under the calendar. So you can see for this particular patient, we have a booking that is coming up on 11th during the surgery when we have created it for, right? So this is the integration flow that we have created. Whenever a record is created within Creator, we want to create an appointment, right? So this is related to the integration flow. So once the lab technician has completed the um, testing, and once they have received the particular report, they can further proceed with adding the bill into the patient name. So let's add a surgical bill over here. Let me quickly refresh it. Yes. So let me try clicking on to add bill. Now what we'll try to add? We'll try to add a surgical bill here. Surgery and name of the surgery, let's see. And the total amount. And the current status is unpaid. Let's add this bill under the patient name. So once we add this particular information, it will be added into the total billing of the patient. So let's enter into the total billing. So here you can see the surgery is yet to be paid by the particular um, patient. Now what we'll do, once they make the payment, we can access this button and make it bill payment done. So under the total bill, you can see the status is being changed to payment done. Now once all the treatment is completed, once all the activity is done by the patient, the treatment is all done. So what will the nurse do? They will proceed with the discharge process of this particular patient. So to continue with the discharge process, they will just make an entry here in the patient information stating that they can be discharged, and notes for reference need to have a follow-up. And then the discharge details. So when the discharge is happening, let's say on 11th, and the discharge summary, if anything is applicable, like keep away from sunlight, and the follow-up date we can have it 1 week next to the surgery, and we have all the statement available here. Once we update this information, this will be mapped under the patient's name, and we have the discharge bill available as well. So upon clicking onto the discharge bill, the patient discharge bill will be provided. We have this created using the snippets, and what we can do, we can take a printout of this discharge bill and share it with the admin, or even share it with the patient if it is required, right? So this is all about the application. Now even from the nurse's dashboard, the nurse will be able to perform a lot of activity. So let's say we enter into the dashboard here. Here, so here once we, let me refresh the dashboard, done. So we have the patient information, discharge details, and here as well we have two reports. One is the report related to the patient who was available, so they can check the information related to a patient just by searching his admission ID, where we have the name, the email address of this particular user, and we have the admission details, and we have other information related to the appointment, and the blood type and other informations are provided here, right? And next, once they enter into the nurse station again, we can view the discharge summary as well, wherein once I click onto the patient ID, we have the details of the patient, the ID, and the admission date, discharge date, and the bill type is the pharmacy based and the surgery based as well. So this is related to the application that we have created. So now getting back into the presentation, talking about other extended use cases. So far we talked about how we can create an application using the internal and the extended Zoho or third party. Right now, talking about few other extended use cases. So we have the patient management based on portal where the pharmacy related informations can be tracked, the inventory management, vendor management, and even the procurement. And then the appointment, so if they wish to have the separate appointment bookings done by the patient, so that can be done under a portal based. At last, it can also be done for a facility management like the external cleaning services or any maintenance services. This can be used. And next we have the inpatient management as a core system. So if we wish to have the outpatient managed separately, like the appointments, follow-ups, and the billing related information, we can create a separate application for it. And then the inventory management separately. So only the pharmacy related information, the clinical equipments, and any cleaning equipments. So that can be maintained and monitored here. And the facilities. So for room cleaning, any equipment cleaning, and even the patient care can be done under this facility management. And the medical staff. So the number of staffs that are available and the payment related information and the recruitment of these different stakeholders can be separately monitored. And camps. So if they have any medical camps, internal medical camps that can be done, and campaignings, any other services that they are providing apart from just the healthcare setting, that can be added here. And the lab related information, wherein the home collection for the samples and the testing of the reports and the samples, and how the reports is being shared and the billing information is being captured, can be done under the core system as well, right? So now that we have come to the end of the 1 hour webinar, so let's take a look at the summary. So we saw about how the different internal stakeholders can be added as an app user to your application, and how they can access the application based on different departments. And later on we saw how we can utilize a canvas builder to customize the detailed view of a report. So we saw the how the overall admission management of a patient is done through a canvas builder. And later on we had snippets. So we showcased you multiple areas in where the ZML and HTML snippet can be used to customize the dashboard. And the integration flow to connect with the Zoho bookings to capture all the doctor book appointments and the scan appointments as well. And the workflows, we have used multiple form workflows and report workflows at multiple modules that we have created, right? And yeah, so this is about the session. And talking about the upcoming sessions that we have, so we have the Creator Tech Connect series coming up in the next week, which will be focusing on widgets in Zoho Creator, which is happening on February 13th. So you can use this QR code to scan and register for the session, or my coach will be sharing you the link as well. And for the next, we have the learning table series for the month of March. So it will be based on the logistics industry, how you can use Creator for a logistic industry. So this is happening on March 6th at 5 p.m. IST. So please note the timings over here, which is based on the 5 p.m. timing over here, right? So I'll keep this open for a few seconds. So if you are interested in joining the session, make use of the QR code or make use of the registration link. My coach will be sharing you in the chat section. And adding on to this, if you are interested in the multiple industry that we have focused in the past years, in the year 2023 and 2024, you can access the course link for the learning table series, and you can register for the course and access the different industry that we have covered based on different application categories as well. So my co-trainer will be sharing you the link for the same for the course. Thank you everyone. We are closing the session for the day. Thank you so much.